It's 9 o'clock. We'll call the special meeting to order. Please join me in the Pledge of Allegiance.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Agenda has been provided before the meeting. Are there any additions or corrections to the agenda as presented?
Mr. Chairman, just like to make a statement that after consultation with the county attorney, in his opinion, this will be an open meeting, not a closed meeting. Okay. So the public is welcome to be here. This will not be a closed meeting.
Okay.
Mr. Chair, I'll move the agenda as presented.
I'd second that.
A motion, second, approve the agenda. Any further discussion? If not, all in favor signify by saying aye.
Aye.
Opposed, same. Motion carries. I guess first order of business is County Attorney Demaine Sandy.
Basically, I've been asked to come here, and I suppose it's because of the Prime West issue. You know, that's the only issue on the agenda today. When Steve got me the information last week, I read through it. He forwarded me a letter to retain the law firm that wants to represent the 24 counties. I went through that this morning before I came down here. Generally, I didn't see anything that struck me as an issue that I need to raise. It seems to be pretty straightforward on what's happening here. You know, a lot of it's going to be what the board wants to decide if they want to engage in this with the other 23 counties. But from a legal standpoint, everything's in order. So it ends up being your call on what you want to do with regard to the resolutions that were submitted as proposed and the engagement letter.
Okay, well, thank you. Do we need to read through the resolution or anything, Steve?
No, the resolution that we have is fine. I included a copy of Resolution 5922-19. That was the one that the board passed on July 2nd. And that was to recommend Prime West as a single plan, health plan in Pipestone County for families and children, Minnesota Senior Care Options, and Minnesota Senior Care Plus. The county has the right to request mediation regarding the health plan selection pursuant to Minnesota statutes 256B.69 subdivision 3A D is where we're coming from on this. So the resolution that was presented today for recommendation is 5925, and that's to request legal services to go to mediation with the rest, the 23 other counties in the Prime West group to do that, so that we can see what's going on at Department of Human Services and mediate that and hopefully get this to a positive resolution for the Prime West counties.
Mr. Chair, I'd move to approve the resolution.
I would second.
Okay, we have a motion, second, to approve Resolution 592519. Is there any further discussion? Not all in favor signify by saying aye.
Aye.
Opposed? Motion carries. Well, thank you, Demaine, for taking a look through that and giving us your opinion on that.
Well, there wasn't much to it.
Right. But I think we need to stand with the other counties on this. This is...
Well, it'd be devastating to Pipestone County and all the counties to go ahead with what they have proposed to us right now. And just for a little bit of input, I'd like to welcome Stacy Jurgensen here and have her just step forward and kind of talk about what it mean to them to implement what has been proposed at this time.
All right.
Thank you.
Good morning.
Good morning.
Thanks for coming.
Thank you. So right now, Pipestone is lucky enough to have a single coverage with Prime West for both their all of their programs, which is wonderful. In some of our other locations, we have multiple insurers. One of the things that I just wanted to bring to your attention is that in some ways that causes a lot more work because each individual insurance program has their own way of doing things. They all fall under the statute and they all meet the statute, but one might want this, this, and this, and this way, and another insurer might want it this, this, and this, in a whole different way. So it's somewhat difficult to always ensure that we are in total compliance with every single insurer, because they all have their own ways of doing things. And when you're working with fairly significant caseloads across the board, you haven't always got time to look at, okay, this is this insurance and we've got to do it this way. You try to do is, get all the statutes covered. And so we do our very best. But it's difficult with a lot of insurers. So that's just from a base service. The other thing is that I noticed in other areas, my counterpart, Stacy Longton, handles the MSHO, MSC Plus, those programs. She runs 4 to 5 audits a year that she and her staff are gathering information for, getting it to all the different insurance plans, and they all want an audit every year, and which is how it should be if you're using their programs. But that's very time consuming. So those are just some of the little nuts and bolts of that are difficult sometimes for our agency at the ground level. The one thing I love about Pipestone and Prime West is that they're very quick to respond, and they have also I know the person that handles mental health in that agency. I can get to them. I have all their contact information, and they can get to me. I also know the person that handles all the chemical dependency stuff, and it's that person. And I'm not necessarily on hold or being passed around to several different people. So that is a blessing, I guess.
Stacy, maybe for people that aren't aware of how this all works, can you give kind of a little bit of a background without going into it in great detail of what this single provider is, that it's for the medical assistance, for Minnesota Care and so forth, kind of the background. And then also we'll talk about where Prime West came from, a joint powers group that we were initiated with back. It's been, how many years? It's been 17 years that Prime West started.
Yep.
So just for people to get a little bit of a background of just what is this insurance coverage about? Is that too broad, too vague? I don't mean to.
Might be, yeah. Can you?
I guess just so people understand that we use this for our Medicare and Medicaid, for our Minnesota Care, and also for our senior health options and the prepaid medical assistance. That's what this is used for.
Correct.
Yes. And then, of course, with Health and Human Services, and then you help administer those. So that's why you're working in close unity then with the provider. So instead of each county doing this individually, then we entered into this joint powers group, and that's what Prime West is all about. So they're not a commercial insurance. People can't go out and buy insurance from them. But Prime West is used by these various counties. Right now it's 11. We're adding another 13 to that as well to expand the footprint of what Prime West does. But they actually do work as truly an insurance company. We've got our own physicians, we've got our own appeals process, of course, they're billing people. And that's one of the things that they really pride themselves on. You mentioned the quick response. So often when you call a big corporation, you get put on hold. That doesn't happen. When you call Prime West, there's a live person picking up that phone right away. And at some of the services that we're able to provide through Prime West.
Yes. So our programs we administer those programs and then funnel it through. They're our funding source. Yeah.
I do know Scott Johnson with Southwest Mental Health has stated several times that he could probably get by with 2 to 3 less FTEs if everybody was Prime West. He says, we spend hours a day on the phone on hold.
Yep. Yep. Let's also talk about the reimbursement rate as well, too.
Yeah. Prime West puts more money back in everybody's pocket.
Yep. Typically, we're looking at 80 to 85 cents on the dollar of what normal charges are, whereas a lot of the other insurance providers that do provide this type of coverage, they're in the area of 60 cents on the dollar, basically.
50 to 60.
50 to 60 cents on the dollar. And the reason that Prime West can do that is because, again, we are owned by the counties. We're joint powers by the county. We're not investor-owned. We're owned by the counties.
Correct.
And because of the efficiencies that we've got built in, that we're able to provide that type of reimbursement versus the 50 to 60 cent reimbursement. So that's some of the positives, some of the advantages of what this Prime West is all about. So for people that are just tuning in, not realizing what the discussion is about, I want to lay out a little bit of a background of why are we entering into this. And then we're being challenged now by the commissioner of Department of Health Services, saying that it's not fair for us to have a single provider, that we need to open it out to the market. So that's what this is all about, in a nutshell.
I just think it's ironic that this was started in the first place because Prime West could do it cheaper than the Blues were doing it. And it saves the state millions of dollars a year.
Right.
And in addition to that, if you look at this local reinvestment sheet, just between Medicaid and Medicare payments over the period they've been in operation, there are over $91.5 million in additional payments have been made that's above the fee-for-service rate to the various providers. And they've been able to do that on top of saving the state millions of dollars a year. All of this money, in addition to the millions of dollars a year, would be going into the executive pockets of, the Blues if they were in our area.
We own it and we can reinvest it.
And also talk about the grants that come back.
Right.
That's reinvesting.
Yep.
Yeah.
It truly is the only rural-based insurance provider that was offered
Yep.
in the process. Everybody else is metro-based or even bigger.
Yep.
Some were Minnesota-based, some are even bigger than that. So they kind of know the rural area. They know what's going on out here, whereas some of the other options,
You may not
their
even be
big
able to see
programs
or-
are all in metro. Mm-hmm.
I just find some irony in it because it seemed like Blue Cross Blue Shield wanted to pull out of here 3 years ago because of the risk they'd take because of the pool sizes, but now all of a sudden they want the open door back in.
Yep. And there are other providers other than Blue Cross Blue Shield as well, too. There's a myriad of other providers, so we can't single out one particular one. But still, this is county-owned, county-based, a single provider, and the efficiencies of it, and that's why we are going to appeal this decision.
And everybody's very, invested in this county-owned process. We all have a stake in it. It's not just, well, here's an insurance provider. Okay, we'll use them, and
Yeah.
we're all very invested in this process and making it successful. So, yeah.
Will Bill Weber get a copy of this request? Keep him up to speed is what we're trying to do.
Yep, we can certainly make sure that happens,
I
absolutely.
think that's been all done through
Should
Prime
be-
West already.
It should be
Yeah.
brought to their attention.
And this, as we know, this challenge isn't new. In fact, 2 years ago, they had tried the same thing, and we were able to go up in the lobby, and we explained to the legislators what this is all about, and we had overwhelming support. So it's actually kind of surprising that this is resurfaced. I thought this was behind us, but it's
Different
another,
people at the top again.
another attack on our county-based purchasing.
It's metro people trying to make decisions for you out here, and that's the problem. The state of Minnesota is really good at that,
Yep.
so.
And on the surface, their argument seems to be legitimate because they say, well, competition's good. Well, in this case, no, competition isn't good because of the density that we've got here in the area and what the market base is. So to say that competition is good doesn't always fit. In this particular case, it needs to be a single provider because that's how we have our efficiencies.
Mm-hmm.
And again, it's county-owned.
Thank you.
Thank you, Stacy.
Yep, thank you.
Do you all have a copy of
Yes.
the? Okay, awesome. Thank you.
Everybody's got that and that. Lots of paper.
Lots of paper.
Chairman, one thing I'd like to mention, if I could, before we do anything else, regarding the legal firm, is that there are 24 counties involved in this, the Southern Prairie counties and the Prime West counties, and they're estimating the legal fees, and this is primarily for people listening and watching the video, and for Kyle, that if the legal fees are approximately $100,000 as they're talking, divide that out between the 24 counties, our cost is less than $5,000. You know, so we're sharing about $4,200 is what we'd be looking at on legal fees on this, since we're all sharing it together, so, you know, for the mediation. So we need to understand that, you know, the value of what we're getting and what Prime West does for us and the value of what we're paying into this is, you know, is pennies on the dollar is what we're looking at if we can maintain this. It's very important to do this. So just so the public understands that as well too. So,
Thanks, Steve.
thank you.
Anybody else have any other additional comments or anything else to bring before the board?
We should remind the state of Minnesota and thank them for making their life more difficult again.
Right. I guess always encourage the citizens, you know, to reach out to their legislators and let them understand that this is an important thing for us. We need people to realize that why it is that we're doing this. It's not just a whim by any means. This is very important that we continue this.
You know, Stacy, about how many clients do we have in Pipestone County that benefit from Prime West? Any idea? Are we thousands? Thousands? Definitely thousands, okay.
Between all the various programs, definitely.
Okay, good, thank you.
I know last fall when I was going around doing the presentations to the other counties, it was, each county varied between 17 and 22% of their residents that are on the program.
Pretty
Some are
significant.
higher, some are lower.
And obviously with an aging community that we're going to have more and more
Right.
need for this. And again, the more local control we have over this, the better.
Okay. Is there any other business to come before the board?
Well, Mr. Chairman, that's the only thing we're dealing with today. Next meeting will be the 13th, next Tuesday, be our first regular meeting. We're going to do 2 meetings a month. So we'll have Highway Engineer Nick Bergman first, so we'll be using that early portion of the meeting for the highway meetings.
Okay.
Having a special budget meeting on Monday.
No, we're on the afternoon of the 13th.
Oh, I thought we were
Thought we
doing
had 2
the
days in a row.
afternoon of the 12th as well.
We talked about that, I didn't think we made that decision.
I thought we did.
Yeah, I thought we did.
But that's what I have down, but I'm open to do whatever you want to do. But
Yep.
Yeah.
I had down both Monday and Tuesday afternoon at 1 o'clock on the 12th and 13th.
Okay,
I don't, but that's,
all right, let me check that, please.
yeah, well, just let us know.
Okay.
Just so we know.
That's, I had it on the calendar.
I
that
don't
way as well,
care
too.
either, whatever you want to
Right,
do. But
either way, just
So we're on the same page.
so we get her done.
we can just cancel it with last year's budget.
Sounds good, thank you.
Are you looking for a motion to adjourn?
If there's no other business.
So moved, Mr. Chair.
Second it.
Okay, a motion second to adjourn, we stand adjourned. Thank you. Again, thanks to me.
Nice to watch government in action.
What are you going to do with Sandy's artwork?